So my name is Chris. I'm going to be performing a few knee x-rays for you. So we're going to be doing an AP, and a medial oblique, a lateral, the Leclerc's method, and a set of gas. Alright, so first we want to get our console set up. Alright, so for technique wise, we want to have it set to table bucky. Since there's a grid, we want to kind of up it to 80 kV, 5 mass should do. Make sure nothing's clear of the table. Looks like we're good. Grab a 10 by 12 cassette, place it inside the bucky portrait. Next, we want a detent or two. Line up to the table. Line up the bucky. Next, let's get clear. Okay. We have some glove boxes for the Leclerc's method ready. Shield for the patient. Alright, and we're going to go get them now. Ryan?
How's it going?
Good, how are you?
Not too bad, a little bit better.
Alright, so my name is Chris. I'll be shooting your x-rays today.
Okay.
So I understand it's your first and last name first?
Yeah, Ryan Hopkins,
And date of birth?
5'9",
Alright. Is there any chance of pregnancy?
88. Not today.
Not today?
No.
Perfect. Alright, so what brings you today?
Well, I was skateboarding a couple days ago and I took a gnarly fall. So, yeah, I hurt my right knee, I think.
Right knee, alright. Is there any certain spots that hurt in particular?
No, I mean, just when I put weight on it and like twisting motions, kind of hurts more.
So it won't hurt too much if I touch it just to feel for anything?
No, I'll let you know if there's.
Alright, sure. Alright, so we're gonna have you lay down on the table.
Okay.
Head on the pillow, please. And can you roll your right pant leg up for me?
Yeah.
Thank you, sir. Make sure to shield the patient. So, judging by his waist, we want to do a 5-degree cephalic tube angle for this one. Alright, so our central ray is going to be entering ½ inch below the patellar apex.
You want me to move over? Or?
I got you. Just a minute. ½ inch below the patellar apex. We're gonna column it on the sides. About 1 inch on the sides. A little bit top to bottom. Place our right marker down. And turn the foot slightly inward to get the epicondyles parallel to the film. Right, just hold still, sir. And x-ray. Slowly relax. Alright, so we can get our film, put in our reader. Alright, so we got a new film. We're going to do the oblique next. Technique is pretty much going to be the same. Just like before, we keep the set lengthwise. Okay, sir, so you're going to have to roll your leg inward. Okay. Alright, so we have condyles are 45 degrees to the IR. Center. And central ray is also ½ inch below the patellar apex. Hold still, sir. Alright, and X-ray. Film now. Run it. Got a new film. So next we're going to do the lateral projection. Same orientation for the cassette. So can I have you roll into your right side for me?
Right side?
Yes. Slightly. That should be good. And knee.
Okay.
So from 2 rail for this one would be 7 degrees to pallet. So we want to make sure that our patella is perpendicular to the table, as well as the epicondyles. Good. Central raise inch below the medial condyle for the femur. Marker. Collimation is good. So technique. We can go with the same technique, so we go ahead and shoot that. So hold still, sir. And X-ray. Alright, so you go get right on your back as well.
On back?
Yes. Film now. We're gonna go ahead and run it. And grab a new film. So this next one, we're not gonna be using the bucket anymore. So we want to lower our technique to about 70 at. Well, that should be fine. Alright, sir, so now if you lift your right leg up for me.
Okay.
You place the cassette between your legs. Prop the leg up. It's not too uncomfortable.
No, that's okay.
So we have the leg at a 60-degree angle. Now we're gonna have to compensate for the SIE mentioned. Alright, so we want it to be perpendicular to the long axis of the lower leg. Entry right half inch below accelerated back. Marker on there. We have our technique set, so we're going to go ahead and shoot that. And hold still, sir. X-ray. Going to relax. Just going to move everything from your leg. Alright, so we're going to go ahead and run this. Grab the new film. So for this next one, we're going to be shooting the patella. Now we want to drop our technique 70 at about 4. Sir, just want you to bend your knee a little bit more.
Doesn't work? Okay.
And how far can you reach, sir?
Okay.
Alright, so we're just going to need to hold the cassette for me.
Okay.
Slightly more. So our film should be perpendicular to the patella. So let me know if you get too uncomfortable, alright?
Oh, that's fine.
Angle. This one's about 15 degrees. We have our shadow of the patella center to the film. Central raise and enter at the patella roll joint. Marker. Collimate in. Right, just hold that, sir. And X-ray. Alright, sir, so you go ahead and relax. Sit back, and I'm just going to take a look at all the images.
Sounds good.
All right, Ryan. So we're all done here.
All set?
Yep. So
All
we're
right.
gonna have your images sent directly to your doctor, so you can just call in for the results. All right?
Sounds good. Thank you very much.
No problem. All right. So here's the AP projection of the knee. We are looking at. We have our femur here, tibia, fibula. You can see the patella superimposed with the femur. I want to check for no rotation. You can see that the condyles are symmetrical. And head of the fibula is slightly superimposed with tibia. You can see the open joint space. Alright, so now we have our lateral projection. You can see the patella in profile. The condyles are superimposed with each other. You also see the slight superimposition of the fibula as well. You can see the open joint space for the patella and the femur, as well as some open space between the tibia and the femur. And the knee is also flexed at about 20 to 30 degrees. Alright, so we have our AP oblique projection of the knee with medial rotation. And we know we have the proper rotation of 45 degrees. We can see the open space between the tibia and the fibula. And you can see the posterior tibia, the plateaus clearly, and you can see the patella poking out of the medial side of the femur, and open joint space as well. Now we're looking at our projection for the Beclairs, looking at the intercondylar fossa. You can see the posterior surface of the femoral condyles, the intercondylar eminence. You check for rotation. You can see a little overlap between the tibia and fibula, and the patella's not in the way of the joint space. Alright, so now we have our tangential projection of the patellofemoral joint using the Settegast method. You can see their patella in profile, and their femoral condyles, and of course the open joint space.